Well, in today's senior segment, Dr. Garrett Peel joins us to discuss the Previty Clinic for surgical care and its state-of-the-art procedures. Thank you so much for joining us.
Good afternoon.
Absolutely. Now let's talk about, you said that you're a breast cancer surgeon.
Yes.
That kind of puts it all into perspective.
One of our
right?
focuses at Previty Clinic.
And absolutely, especially with it being Breast Cancer Awareness Month, that's something that, needs to be at the forefront of people's minds.
Yes,
get
this
checked.
month is so important because it helps us talk about breast cancer and how we can prevent it, treat it, diagnose it. Our goal is to treat breast cancer and diagnose it within 14 days. That's
Wow.
our goal at our clinic. But what's key is that mammography, early screening, and self-breast examinations save lives.
Yes.
When you have 1 in 8 women in our country that will be diagnosed in their lifetime with breast cancer, it's important that they find that breast cancer early because then we can basically focus on how we can treat it without having to remove all of the breast tissue.
Absolutely. Now let's talk a little bit about the new clinic. It just opened and the advances in technology that you offer that's not really around this area.
Sure. We just launched the Sandy Fertitta Modern Breast Cancer Surgery Institute at Previty, and that's a very exciting place because it gives women a safe harbor where we can educate them, diagnose them, treat them, and provide the most technologically advanced health care as possible. And our partners with Baptist Hospital, the Dauphine Screening Center, and also the diagnostic group, it provides a team approach to breast cancer. Breast cancer, once diagnosed, has to have a team. It just can't be a surgeon. It just can't be an oncologist. It requires a real team approach, and that's what Diagnostic Group and Previty can provide.
Yeah, take a look at it and say, how can we save this person's life?
Absolutely, from the start.
Okay, so now let's talk about a little bit about Angelina Jolie. I think people kind of can put that into perspective as far as what happened to her and the decision that she made.
Right.
You guys offer that as well, that testing to say you're pretty much a candidate for breast cancer.
We offer genetic screening, okay, and it is a comprehensive approach. It basically takes a look at the patient, their family history of breast cancer and other cancers, and how that can contribute to their individualized risk of getting breast cancer. In addition, we calculate a percentage, it's all numbers, but then we also do a test of their actual gene to see if they have a breast cancer gene. And if you do have a breast cancer gene, you're at a very high risk of developing not only breast cancer, but potentially ovarian cancer as well. And men can have positive breast cancer gene as well. In fact, they're carriers of it, and they're increased risk of pancreas and prostate cancer. What Angelina Jolie had was what we call a preventive mastectomy. So she didn't have cancer, thank goodness, but what she had was an approach similar to what we provide here right in Beaumont, a skin, nipple, areolar sparing mastectomy, where we make a very small incision, go in and remove all of the breast tissue, leaving the skin, the nipple, and the areolar behind, and doing an immediate restoration with our plastic surgery colleagues. And I tell you, I'm very proud of our results with that because patients really have a way to have a cosmetic, beautiful result without cancer or even being cancer-free in the future. But when we're also talking about how to check with breast cancer up front, we offer what we call partial breast radiation. Through breast conservation therapy, you don't need a mastectomy anymore. We can actually save the breast tissue, remove the breast cancer, check the lymph node, and then do what we call 5-day plan or a 5-day partial breast radiation treatment instead of 9 weeks. And we use this catheter that goes right into the breast, and we treat the breast from the inside out for 5 days with our radiation colleagues, and the patient is done with their radiation treatment. Phenomenal, right here in Beaumont, Texas.
Absolutely. Well, I have to say, years and years ago, my grandmother had breast cancer. She was a survivor. She had a myomectomy, of course. And at that point, it was kind of like watching her and what she went through. And it just feels like the things that you're talking about, it just makes you feel so much more confident, so much more willing to go get tested and not have to go through so much. It seems like things are a lot easier these days.
Correct. Even if you're young, 35 or above, talk to your doctor about your breast cancer risk, get a mammogram, do your self-breast exams. It can save your life.
All right. Thanks so much for joining us.